Good afternoon. Thank you for coming once to another one of our board meetings. And we have a pretty full meeting planned. So we're going to, most of it is plenty of time for anybody who wants to ask questions or make comments, but we'll get to that point. First, as it says in my script, I need to call the roll. And before we start, one member could not be here today because of a irreconcilable conflict that arose at the last minute. But as you will see, after we call the roll, we still have enough for a quorum, which is 6 of us. So let me start with Dean. Introduce yourself. Lisa. Another Lisa. And I make 6, Stuart Rabinowitz, and I'm pleased to be here, and I'm pleased that you're here. So the first order of business is the approval of the minutes of our last meeting, which was September 30th. It's been distributed to all the members of the board who are present. It's in your package. And do I have a motion to approve the minutes? Usually second. Okay. I'm sorry. Okay. Okay. Dean and Lisa. Dean makes the motion. Lisa seconds. All in favor? All opposed? Okay. The minutes are adopted and the motion passes. Before I turn the floor over to our interim CEO, Dr. Becker, I have a happy announcement to make. I don't know if you've been reading Long Island Business News or Newsday Online today, but there are 2 nice stories about a gift from an anonymous donor. I tried to talk them into revealing themselves, but they didn't want to. Either they were hiding their money from somebody, or they didn't want to be swamped with more requests. But NUMAC got $1 million gift, check in hand, not paid out over time. I raised a lot of money in my day in a different role, but it always was payable over umpteen years. This was a flat-out $1 million gift to NUMAC to use in a way that we're going to use all of our gifts, which is to help help us treat our patients with the latest equipment and the best care that we possibly can give. And this gift will help us get new and updated imaging equipment in women's health, both diagnostic for the purposes of detecting the lack of or the presence of any breast cancer, and an updated bone density machine. So both of these pieces of equipment, all of these pieces of equipment were outdated that we presently had, and now we're going to have, because of the generosity of this anonymous good plural guys, we now can buy and purchase the most up-to-date equipment to the benefit of our patients. And it's great to see 2 good stories in the press about NUMAC. I mean, to me, this is more than just what we're getting with the gift, although that's crucial, but the fact that there are people out there who have enough faith in the new leadership, in the existing staff, nurses and doctors and staff, and who are willing to bet big dollars on our future. And that is the kind of thing that we need to do more of. And Lisa Warren and I already agreed. We're going back to the same donors with another project, but we are. We are, because they got more money. But there hasn't been enough attention paid to private donations here. And we are going to change that little by little. It's not, don't expect every meeting we'll announce another million, but we will be working on it. Uh, and, and the staff will be working on more fundraising.
We will, and I believe in everybody being a fundraiser, so the whole board, we all will become fundraisers.
Yes, we will. I promise. I'm good at it. Okay. Now, and people should do what they're good at. So, I would not like to now turn it over to Dr. Becker. Um, I know I compliment him excessively, and he, his head is growing as we sit here. Every meeting his head gets a little bigger, but he deserves it. He's doing a fabulous job, and let me turn it over to Dr. Becker.
Listen, if you get your CFO smiling during budget season, that's quite an accomplishment. So yeah, but so thank you, and it does go to it does go to a really good cause, women's health, where the equipment we had was just subpar. It's just subpar, and this is going to bring it right into the 21st century, which is phenomenal. So we're excited about that, and we'll have many more hopefully. So. Um, I've got just an outline of what I'm going to review, just an overview, talk a little bit about finance, clinical, and operations, a little more about HR focus, and a focus on workplace safety. We're very concerned and interested and want to really improve there, and then just a brief summary, and let's get right into it. So we have a lot going on. I mean, that's even an understatement in each of these key areas. We continue to make amazing clinical progress. We'll talk a little more about that, and it's really a team effort. I think Perry Elshanawani, our chief clinical officer, along with Rivka Mintz, our chief nursing officer. Those two have to kind of work hand in glove, and if that doesn't work, then it doesn't happen. And they really are doing a phenomenal job, along with many of our chairs, our chief of medicine, Dr. Mustachia. Others are really kind of pitching in and making this work, and it's a lot of hard work and sometimes disruptive in a way at first, where we've done it this way for so long, and to change takes a gargantuan effort on behalf of everybody. But it's a leap of faith, and we've got great results to show for it, and we're going to do much more. So that's been going very very well. We are focused on many areas of the clinical entity: inpatient, outpatient, medicine, surgical, behavioral health, you name it, women's health. We're really focused on improving everything. We do try and focus our energies, because if you try and improve everything all at once, you generally improve nothing. And so we're focused, but that doesn't mean that we don't have an eye on every area and that we have plans to improve everything collectively. And we're starting to see that, which is really great. Um, we're bringing in a new chief of quality and a new chief of infection control, areas that are critical. It's important to recognize and thank Katie Mankiewicz, who has been in the interim director of quality role for a while now and has just done a remarkable job. And it's not taking anything away from Katie's efforts. The person we're bringing in is senior and very, very experienced in this area. Um, we see, you know, a bright future for Katie here, and are excited that she's staying and continuing to work at quality. It's an area. Remember, we're a 1-star hospital now, and we're on a pathway to be a 5-star hospital. That will take some time, but that's the objective. Also focusing on infection control, someone who's very experienced who will start also on Monday, working in this area, supporting, you know, Rivka Mins, our CNO, and Dr. El Shanawani, our CMO, or Chief Clinical Officer. So, this is going to hopefully accelerate as we dig deeper and really focus on some of the issues that have kept the quality metrics and infection control metrics of this hospital far too low. So that's really positive news. On the operational side, we'll get into it, but we're very focused on metric-driven, data-driven operations. But we're also doing this in a way to build additional efficiency in, and I've got more on that in a minute. A lot of financial progress that's being made. We've got incredible leadership in our finance department with Rich Miller, and if I wind up, some of our leads, either Samantha McLaughlin or Sam Shutman or Laura Crable, they can give dissertations on how to improve revenue cycle and manage care rates. And there's so much work to do, but it's getting done. And we're going to see the results of this incredible work in our 2026 budget with, I think, a significant revenue lift. We'll talk a little more about it, but the budget will be ready to present to the board at the next board meeting, which is in early December. And so we'll have a budget that we have confidence in and that was done very carefully, constructed very carefully at that next meeting. And then the chairman, I'm sure we'll talk more about it, but we're entering into a strategic planning process where we really are very careful and thoughtful about the future of this medical center and transforming it in a way that will ensure its sustainability and viability, and also ensure that it stays mission focused and does what we need to do mostly, which is serve those who have no other choice on where to get their health care, and do it in a really outstanding way. So there's a lot to that strategic planning process. It's just getting underway. I'll leave it to the chairman to talk more about that if he likes, but that's an exciting thing that, of course, the management team will be involved in. And so, our current focus is no different than 4 months ago when we all started here, which is just to aggressively implement clinical, operational, and financial management strategies to really visibly improve how care is being delivered and the whole patient and provider experience here. And we're making good headway. We'll talk more about that. So with finances, nothing new here. Just one error that I presented here on the far right-hand column where it says variance to budget. That $10,435,000 is not a favorable variance. It's a negative variance. So that should be also in parentheses. We left out the parentheses. My bad. But the bottom line is the same, that we have a loss before other than post-employment benefits of $19 million variance to budget, which is really a $73 million actual loss. And then when you put in the OPEB, it's an $87 million loss year to date. Not good news, but that's what we're focused on working on and improving. The numbers were down for a couple of reasons off of budget. Again, and we talked about this, a lot of the assumptions that were put into the 2025 budget by the previous management team were just unachievable, and there was no chance that was going to happen, and so that on the revenue side was a challenge, as it was on the expense side. That said, partly because of, we think reputational reasons, partly because there's a lot of urgent care sites springing up around in the immediate radius. ER volume has been significantly down, and much of our inpatient volume is derived from our ED volume, and so that's an area that we're focusing on. We believe that we can change that, but for this immediate point in time, it's caused our revenues to drop off a bit. Operating expenses were higher, just a little over $10 million than budgeted due to higher fringe costs. The fringe benefit costs are very high here, just historically. We obviously, because of the abrupt management exit in June, needed consultants who've done a great job for us, but come at a high expense. And so that's part of this budget. And then our utilities, we had to rent part-time chillers when our chillers went out, and we've got lots of other immediate fixes, which are going to be addressed hopefully in our capital request to the state. But that when you have to bring in chillers immediate on short notice, you tend to pay top dollar for that, which is what we did. So that's where the finances are right now. I'm very happy about our budget timeline, and this is the slide I used, I think, a month ago at this meeting. We've been meeting with every department. It's very time intensive. Our departments, our chairs, our non-physician department heads have done an amazing job putting together very detailed presentations with as much data as they have. Our challenge is the data here is not what you would typically expect, and doesn't have the kind of detail that helps you formulate a highly accurate budget. So we do the best we can with what we have. That said, we're pretty confident and that we are understanding very well how different departments work. And part of the reason we go through this almost interview process, which is at least an hour, if not more, with literally every department in the medical center, is to really get a greater understanding of how each department works, what the challenges are. Department heads come in and ask for things, and we ask them to justify that and tell us why, and tell us, well, why is that vacant? And do you need that vacancy? And do you need those supplies? And what about overtime in this? How can we mitigate that? And so on and so forth. We go through this line by line. And in fact, we have only one or two meetings left. I think we have, Rivka, we have nursings tomorrow. We allotted 3 hours for that. We're praying to God it doesn't take 3 hours, but it's the kind of thing it's so important. And then, and I beg your patience just to understand the budget process, because it's a very vital process. We then take time and put that all together, and that will invariably, even at medical centers that have all their acts together, the first pass at budget shows a number that's way too unfavorable to where you need to be. And so, like all of us on the C-suite team have seen this and been through this many times. And so you take out your pencil, sharpen it, and get to work. And that doesn't mean that, you're eliminating people or you're doing bad things. It's just about rethinking it and, making compromises on what's being asked, and then putting in place, various targets and objectives that we're confident that we can reach. A good example, and you'll see this, is length of stay. As you'll see from a very nice diagram, we've been able to drop length of stay from over 8 days to 5.7 or so, something like that. And so, in next year's budget, we'll say, well, how much lower can we get? Because each incremental drop in length of stay has $1 savings to it. And that $1 savings goes towards, improving our budget target. So if we say, okay, I think we can get to 4 days instead of 5.7, that will have a calculated, savings that will build into the budget, and then we have to work hard to get there. So we do that through, every department of the hospital, and, that gives us a better result. That's our process. It's not a process that was really utilized here, at least in many, many years. And we believe that the budget we present at this meeting in early December will be one that we're very confident in and that has been, thoroughly reviewed and processed the right way. So we're very happy about that. And again, everybody's working hard on this, but just a special thanks to the finance team because it's an incredibly big lift, especially without, the kind of systems and data that we would typically have. So, Rich, Samantha, the whole team is just doing great work there. I love this diagram. So, I'll keep showing it, because it's all going in the right direction. If I stop showing it, it's not going in the right direction. Now I'll always show it. But, there's total length of stay. It's a little higher because we have, behavioral health and the total length of stay and those stays just by their nature tend to be longer. But when you look at med surge length of stay, which is the one where we can really make progress on, you see remarkable improvements. And then you can see what I just mentioned. We've got a long-term goal. It's really not a stretch goal. It's a required target. I need to change the wording. We're going to get to 4 days, at least with this case mix index. And it just shows you that, it can be done. It can be done in a short time with focus and diligence and alignment. And that's what we're doing. The restructuring that has been happening in nursing and, with the physicians, it's really having a positive impact. And, honestly, it's just a better, more enjoyable way for people to practice and deliver care. And so we're seeing, I think, the benefits of that on many fronts. It doesn't mean that, it takes a little while. It doesn't take a little while to get used to. It does because you're doing things differently. But once it settles in, then, you get results like this. It's very encouraging. Nursing is critical to this, as I've mentioned, and Rivka and her team are doing lots of important things that are really engaging our nurses on a one-to-one and group level. That's important. We're also recruiting nurses. We had a nursing recruitment fair just recently and had well over 100 nurses show up, which is incredible, especially since our pay rates are lower than they need to be. We need to address that in the long term or not even long term, in the short to intermediate term, let's say, and we're going to get there. But it's very encouraging to see that, people want to work here, and it's a great place to work, and we're going to continue to make it better. So, a lot of work is going into this, a lot of thought is going into this. We're trying to connect and stay engaged with our teams and our staff. Shakira, you and your team have been, incredibly helpful to just, let us know where the hot spots are and who needs some attention and support. And that's very useful. So we got partners all over the place throughout this hospital that are really helping us, know where to focus and where to engage. There's over 1 million square feet in this hospital. And so it's hard to be everywhere. So we rely on our team members and our partners to kind of help steer us, which is great. On operations, Trent Crable and his teams are really digging in, looking at how we're organized to become more efficient and to kind of restructure operations so that it makes sense who's managing what and how it's being managed. And then there was a lot of management that wasn't data driven. So introducing a more data driven process and a more data driven way to look at things, even when we don't have all the data, just having a more analytical way to look at things and then hopefully getting the data as we build those dashboards is just a better process and a better way to move forward. And that's what we're doing. It's not an event. It's not an event. It's a process. And we're moving as fast as we can along that line. On the capital budget side, as I mentioned, as recently as I think 3 hours ago, Rich Miller and I had a very supportive conversation and an encouraging conversation with the State Department of Health leadership and also someone from the governor's office to kind of walk through our first $50 million or $45 million request for capital. They had a few things that we need to do to, reformat things and explain a few things, but this is a process that has a cadence, and we're very, optimistic and very positive about that. And so we're pushing that. Just so you know, we've got great interest from the state, as we know, but the Commissioner of Health is planning to visit us in early December, and we're very excited about that. He'll bring a small team here, and we'll present, and he'll tour the hospital, and we're thrilled about that. So that his team, he and his team, Dr. McDonald can see firsthand, you know, what our challenges are, but also like how why exactly why we're so optimistic and positive about Newmick and its future. And I think that translates into something that's really meaningful. We've got a number of different focus projects happening. I mentioned in length of stay, ambulatory care transformation. We're very focused on that. We're looking at a deeper relationship with Harmony Health, our FQHC, and those conversations are going very, very well. We're excited about that and believe that will just add depth and efficiency and a whole new dimension. They have a great reputation, and so aligning with them will be very helpful to us. That's by no means a done deal, but it's something that we're very focused on. I mentioned our perioperative process. There's a lot of progress there just to make the operating room more efficient, a great place to work, and a great place for patients to experience surgery. Hopefully, patients are asleep for surgery mostly, but that's our providers, our physicians, our nurses. We want that to be a great place to work and a very efficient place to work in, and we're getting there. We're also, starting some additional areas for focus in infection control, in supply chain. We're going to look at IT. There's a number of focus projects that we're doing to really drill down and analyze, where are the bottlenecks, where are the choke points, how can we make a process better, how can we address these big issues, and all of these have a finite timeline with clear deliverables. And if we get stuck, which sometimes we do, we circle back with that team and keep it moving forward. And so we've been able to demonstrate remarkable progress in these and many other areas. You're only as good as your team and the people here. Of all the systems in the world, you don't have human resources straight, and if your people aren't focused and feeling good and engaged and happy about the work they're doing and where they're working, it's not going to work. And so, like, the top line piece of all this is, we need to make this a better, safer place for people to work. A lot of committed people here over many years, and also some, a good number of new people who are interested and want to, understand. So, what is it like to work at Newmick? And so, we're focused on providing clarity and clear communication around things that are, touch points for people, and we want to make sure that people feel that there's no special treatment of others. That everyone, is treated fairly and respectfully, and that there are rules that are clear and communicated easily and are followed. And so we're walking through, our productivity and understanding, well, why are we, spending so much money in areas where we may not have to? Like, what are leaves of absence? Every time someone takes a leave of absence, it's not that they're not entitled, but that has an impact on the people who are here working. And so we want to make sure that that's used appropriately. Strengthening our time and attendance compliance and policies. Looking at how we develop our team and staff. Helping people define the arc of their career. That's something that many organizations, healthcare organizations, do very well. I'm here as in a position, and I love this work, but I also don't want to do this job forever. I want to grow and develop. How can my organization, where I'm contributing my time and working very hard, how can that organization help me grow and go on to do something else that might be interesting, more remunerative, and just engaging in a different way? And so we're very interested and focused on doing that and being very active in that. And it's wonderful that we have, as our chairman, a former president of a university that's all about education and leading. And so we're focused on those discussions and we want to build on that. And then just looking internally at HR to make sure that our HR department serves the team and the staff the way it should. HR departments are a resource for people. You have a question, you have an issue, what you want is an HR team that's supportive and can help guide you as an employee to the right answer and one that works well for you. And so making sure that we can do that efficiently and effectively and respectfully is something that we're very, very focused on. Oops. This is, I mentioned we were focused on, employee safety and decreasing workplace violence. Tara Brown, thank you, Tara, for putting this slide together and for your work in this. We've got a lot more workplace violence. WPV is workplace violence. We have a lot more workplace violence and disturbance stats than are acceptable. These numbers should really be single digits, and they're not. They're way into the triple and quadruple digits. And so we've got to work on that. And there are kind of 4 areas of immediate focus, which you can see on your right: the physical environment, the policy and procedures, reporting and investigations, and leadership support. And I'm not going through it now, but under each one of these, there's a ton of detail and a ton of work that needs to be done and is getting started. The overall goal is to, make sure that people don't have to think about, am I going to be safe at work today? Or, am I going to get, struck by a patient, or am I going to be threatened, or whatever? That should not be on anyone's mind. And it is. Part of it is that, we have a very large behavioral health population, which has more of a tendency to be aggressive in these areas. And then some of it is not related to that at all. It's just how we conduct ourselves and, what tone we set for ourselves and for our visitors. And so we need to look at that, focus on that, and then, change a lot. And that's getting underway. And we expect a lot and expect a lot quickly on that area. So, just in summary, we're now just a little over 4 months of a new approach, and as I said, when I opened, new is good, but new is often hard, it's difficult. And so I first want to thank, my team, but even beyond my team, the staff of this hospital for, just being open to accepting change, because, more than any place I've been at, and I've done a lot of, change management and turnaround work, NUMIC is really unique. I mean, we've never felt, change so welcomed. Not that everybody's always smiling about it. We know. But there is a general acceptance and an understanding that in the long run, this change is going to be good. And there's a very positive future ahead if we all just kind of work through the tough stuff and, stay focused on what we know are the right things to do. And that's what we're focused on, aligning everyone towards our common goals. And they're right there in front of us, building and rebuilding, communicating, educating around best practices, doing a lot of listening. We want to hear when things are not going well, because sometimes we know that certain things won't go, but we want to hear it, and we want to be able to, make it go well and do it with alacrity. And so I just would say thank you for continuing the journey with us. It's an amazing journey. We're making real progress. We're thrilled about being here. This is a fun place to come and work because you can accomplish so much here, and it's thanks to you all that we are. So let's keep it up. Thank you to the board again for the tremendous leadership and confidence that you've put in me and the management team. It does not go unnoticed. We talk about it every day, and it means a lot. So with that, I'll turn it back over to our chair. Thank you, guys.
Thank you, Richard. You can be sure that when you hear from our CEO our management team and from the board, you will hear the news. You will not hear necessarily good news when there isn't, and when there's bad news, you will hear that, but we will not be saddled with bad feelings about bad news. It's only a spur to do better. Um, and Richard and his team are on the way to do that. We are in the final stages of getting a permanent or a new seat. Nobody's permanent, not even me, but not an interim CEO, and we should have one announced certainly before the next board meeting. But I can assure you that we are looking for a person who has all of the traits that you've seen from Dr. Becker. And there is not going to be any change of focus or attitude or approach to the human beings who make this hospital work in the new CEO. Otherwise, we won't appoint them. And this board is not going anyplace. This is a very, like somebody gave me the phrase tiny but mighty, but we are a mighty board. This board is very, very committed to the well-being of this hospital. And we're not going anyplace. And so, except forward with you. Richard spoke about a planning process. So you all know that the statute that governed us, that created us and governed us, requires that we make a report a year from December to the governor on what we think needs to be done. Needs to be done in order to have a financially stable hospital, a safety net hospital on Long Island, one that doesn't require hundreds of millions of dollars of aid coming from anybody, any governmental agency every year in order to meet its payroll. That just it's not going to happen, and that can't be our future. We have to have a financially stable hospital. But I'll say it again because I hear this stuff all the time from some people. This hospital isn't going anywhere. There's going to be, at the end of this plan, a safety net hospital on Long Island which meets the needs of the people and the communities that we serve. It's not going to be just a psychology or a psychiatry hospital. It's going to be a safety net hospital which is financially stable, but which serves the people we need. And the one priority that Richard holds dear in his budgeting and his decisions on where to reduce expenses and where not, and that our planning will have, is that the quality of care that we give to our patients would not only stay as good as it is, but will be enhanced. That's why we exist, and that will not change. It will be enhanced by the end of the plan, by the time we come up with a plan. Let me tell you that we have a board committee, a small board committee. We're our small board, working on the beginnings of the plan, the longer range plan that we submit to the governor and the legislature in December of 2026. But every single member of the board, in a very studied and careful way, will be involved in that planning process. I also want to assure you that that planning process will be transparent, that we will hold meetings and sessions. I mean, 2 of them are required by law, that we hold public sessions on planning before we come up with a report, but there'll be more than that because we want your opinion and your views. We don't know everything, and we want your opinion on your views on how to create, at the end of the day, a financially stable hospital, but one which provides wonderful service to the communities that we we serve. So we've already begun a little. We are sending out RFP, which is a request for proposals for an expert consultant to help us with the planning, and somebody who knows, or a firm that is familiar with what other hospitals do and what they should be doing, who has a sense of where the changes are coming in terms of the federal government, and who have expertise in this area to aid us in making our judgments. We are also sending out another request for proposals on long-term care, on Holly Patterson and long-term care. How can we better perform those services and improve our long-term care treatment and facility, and yet make it in such a way that we don't run a loss of $25 million a year, which is currently the projected budget of Holly Patterson is. We just, nobody else does that, and I don't think we can't afford to do that. So we have that as well. And we also have charged a firm with informing us of our possible, all this is possible options of monetizing some of the real estate that is owned by the Nassau Healthcare Corporation, but is not which may not be utilized to its full extent. So there's land behind us, which we will want people to analyze about whether we're using it productively, or are we better off trying to monetize it. There's land behind Holly Patterson, which is not being used at all. And these are ways to increase the resources of the hospital, perhaps, so that we can provide the services that the hospital itself, that NUMEC itself, needs to provide to its communities. So we're going to have 3 experts, but the decision is not the experts. Experts only recommend. The decision will be ours and ultimately the governor's. What I think I've left out of this is, of course, the new CEO will have a tremendous impact and input into the new plan, as well as Dr. Becker will, because our plan is to retain Dr. Becker for a period of time as a consultant and a transition consultant for the new CEO, so that we don't go back to square one, which is where we started, which is nobody here with any, nobody at the C-suite level with any knowledge of the history or the current state of the hospital and a Holly Patterson. They left. There was nobody here when Dr. Becker came in, and I came in. So we're going to make sure the new CEO is not in the same position, which is why we're we're confident we can maintain the staff that Dr. Becker has hired, which has performed, at least for a while, which has performed fabulously, and you saw the results from his presentation. That's all I had to say about that. And now I want to hold the floor for any comments or questions that may arise in the audience. I am no longer going to ask who registered to speak, because nobody ever registers to speak. You don't have to register to speak. All you have to do is raise your hand. I would ask that if you want to make, I talk a lot, so I understand if you want to talk a lot, but I would ask that you keep your comments or questions to 3 to 5 minutes, so that we can go and finish our agenda. If you want to argue, I'm good at that, But this is not the occasion, I think, for us to argue, but rather to respond to questions that you have. I will, on behalf of the board, or call on somebody to do so. But all comments are welcome. So, does anybody have a question or comment? Even if you haven't registered. Okay. I talk so much, nobody has any comments. I gave a lot of information. Okay. So, stay tuned. Our next board meeting is December 2nd. Though it'll be a very important meeting and one you will want to certainly know about, whether in person or otherwise. It'll be the new budget for the next year. Hopefully before then, we might have a new CEO, but certainly by then, we will have a new CEO. So stay tuned for the next meeting. And I think now that we've finished the open part of the meeting, for now, I would like the board to go into executive session. I think it's, if I hear a motion, to go into executive session pursuant to and accordance to the law. Our new general counsel, Dan, has actually given me the section of the law, Public Officers Law, Section 105. We would like to get Resolution 19225, 2025, for us to go into executive session for matters dealing with appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of particular person, and proposed, pending, or current litigation. Not all of those things, but those are the reasons why you can go into executive session. So do I have a motion to go into, from a board member to go into executive session? Dean seconds it. Yes. And we will come back. We will come back and have resume our open sessions for any of the true soldiers here who want to hang around and wait for us to come back from executive session. Thank you for being polite and attentive. Oh, all in favor of the motion? Aye. Okay.
Tell Nancy we owe her one.
Yeah. Oh boy, do I owe her.
Oh my God.
All right. I swear that we took no action in executive session that requires we repeat anything or reveal anything in open session. Mainly, we just debated everything. Okay. Oh, yeah. Okay. Amy.
I'll make a motion to open up the meeting.
Not Dean.
Oh,
Lisa.
second.
Okay. All in favor? The meeting is reopened. All right. We have some important personnel matters and appointments that we need to get approved. We need to do it in open meetings according to the open meetings law. And, of course, we always abide by that. And I have asked our general counsel, Dan, to replace Manette because he's much less expensive and he's also much nicer, in my humble opinion. Oh, come on. All right, scratch that. But Dan, you make the announcements and then I'll move for vote.
I got this. All right. So we have a number of resolutions to approve at today's meeting that are critical for hospital operations. Wow, there's a lot of people here. All right. In your packets, we have included in a resolution that would authorize and empower officers of the corporation to execute certain contracts entered into by the corporation. This resolution is designed to limit this authority to those contracts for which the responsibilities are inherent to the respective positions of each officer with the following monetary limitations. The CFO may execute contracts up to $50,000. and the CLO and COO may execute contracts up to $30,000. I'm asking for.
No, you're not.
No, I'm not.
Yes, I ask for motion approving this resolution, which is included in the.
This is resolution 194.
194. I move that. Dean seconds it. All those in favor? Opposed? Go ahead, Dan.
All right,
Speak
so
into the
I'm trying to. This is not really. In your packets, we have included a resolution authorizing amendments to the employment letter agreements for two officers, the Chief Nursing Officer and the Chief Clinical Officer. The corporation recommends amending the term and compensation of these officers. The amendments will set the CCO's term at 1 year and the CNO's term at 1 year and 4 days. Each agreement will have 2 6-month renewal options, replacing the current 2 3-month renewals. This will promote continuity and stability across the system. Recognizing that these individuals have assumed additional duties and responsibilities, both officers will receive an increase in annual compensation. The CNO employment letter agreement will now include a 3-month severance in the event she is terminated without cause or she resigns for good reason.
motion to approve. Second. I would just
This is
add
resolution 190.
both Rivka, Mintz, and
Perry.
and
Perry.
Kara. Done a fabulous job. We'd be lucky if they stayed longer than this, but this is all they agreed to at this particular point, so I think we should vote in favor. All in favor? Opposed? Next.
So approve the resolution for 195, 2025. In addition to these contracts, your board packet includes a list of contracts entered into by the corporation that do not require board approval, but is providing notice to the board of the contracts entered into. These are for resolutions 196, 2025 through 216, 2025. No, we don't. And, pardon me? In addition to these contracts, your board packet includes a list of contracts into by the corporation that do not, actually, I think they do require. They do. They do require. All right, so there's a list of contracts that require board approval.
Would you tell the few people, the few party people who are here, how many contracts?
22
How many
contracts.
that we have that you are charged with reviewing?
Well, there's 22 that we are seeking.
No, not just today, in general. You gave it to us in executive session.
A little over 2,600.
Right. There are 2,600 contracts, and many of them have not seen the eyes of an attorney, I believe, until we took over and hired Dan. And so these are contracts that are essential to our operation, which need to be renewed, which Dan has at least looked at with a practiced and educated eye.
Thank you. So we're going to be approving contracts that do require board approval. And I don't know. What do we do?
Well, there's no harm if it doesn't, if we approve it anyway. So there you go. Oh,
Thank you. All right.
all in favor? Okay.
The credentialing packet was distributed prior to the meeting and included in the meeting materials. Yes.
Okay. Anybody have any questions about the credentialing? All those names and backgrounds have been listed for you in the materials. Oh, and the what? I'm sorry. Okay. A motion to approve?
Second.
Rory refuses to raise his hand. Let the record reflect that Rory doesn't raise his hand. Okay. All in favor? Aye. Opposed? None. All right. Nancy has to eat. Is there a motion to adjourn? No, that is
He set him up.
every time. We just did that. All those in favor of adjourning, and thank you all for showing enough interest. Yeah, really, we really appreciate it. It means a lot. Thank you.